decided to become a psychiatric nurse because I've always had an interest in psychology and how the mind works and how it affects people.
I became a mental health nurse because I believe that we are all in a lifelong journey of becoming who we're meant to be.
I love working in mental health because the clients are so unique and wonderful, and you work very closely with them as a nurse.
Some days people are going to have worse day than others, right? So you have to be very adaptive, right? I find like being a mental health nurse, it's one of the skills that we have that other nurses don't have.
It's all about empathy and about understanding, really understanding the kind of phases that people go through in a mental illness.
I'm working with these people in a vulnerable state in their lives where they've come to hospital, where they've been brought to hospital to receive treatment, to receive help. So I'm just there to help foster the recovery process for them, help facilitate that process for them, to see them get back into the communities and live as optimal a life that they can live.
A lot of the clients that we work with don't have that many family or friend supports out in the community. A lot of them have been institutionalized for sometimes decades. So I think it means a lot to them to have the support system in place.
I think the most important part of what we do is developing relationships with people to help them to foster recovery.
Mental health nurses, they have the ability to develop more of a therapeutic relationship with the client. Therapy can be anything from going for coffee with a client, which can be extremely meaningful for them. A lot of our clients don't have family, so you're their go-to person. Of course, maintaining a therapeutic boundary and a professional relationship. It's very meaningful and special work.
Mental health nurses, they make you feel normal. They can make you feel as though what you're experiencing is not out of the ordinary for them, and that you can get through it.
Part of the therapeutic approach that we have and the relationships that we have with our clients is built on that hope for the future, creating a vision with them of themselves in the future doing better.
When you're able to see someone at a very ill, very psychotic stage in their life, and you start to see them recover, start to see them get better, start to see them be able to maybe go back to work, repair damaged relationships with their family members, those type of things are rewarding, to see that the person's recovering and that you helped.
Last week, I just bumped into a client downstairs. He hasn't seen me, I haven't seen him in about a year. And he came in and he's like, "Hey Paul, can I give you a hug?" And I'm like, all right, whatever. So I gave him a hug and came up and told me that he just wanted to thank me for advocating for him and fighting for him when he was here and treating him like a human being.
Mental health nursing is about connecting with people and working with them for them to discover or rediscover the hope that they have, that they will be better in the future.
My hospitalizations and even my outpatient recovery wouldn't have been the same without nurses. Thank you a million times.